Welcome back to another mini episode of Cancer Buzz. On today's show, how to build trust with marginalized patient groups and create an equitable care environment. Our guest today says cancer care programs need to build trust with diverse patient populations, a critical first step to improving health outcomes. Dr. Nadine Barrett is the director of the Office of Health Equity and Disparities at Duke Cancer Institute. She also serves on ACCC's Board of Trustees.
Unconscious bias or implicit bias really shows up in cancer care in multiple ways. A lot of this is not unique to cancer by any means, but most certainly as we think about cancer, it's important for us to note what they are. And so some key examples of studies that have really kind of highlighted this. I'll give a great example even in the context of clinical trials, which also crosses over in cancer care. So a study that was done by one of my colleagues, actually Durant Reagan at University of Alabama, really noted after looking at cancer centers across the country, having 91 interviews to identify what are some of the key challenges that impact participating in clinical research and trials for underrepresented race and ethnic groups. They found that there were consistent stereotypes and implicit biases through these interviews that were self-reported by the interviewees that noted that they have perceptions about that patient. And so if they look at a patient and think that they may not have the social support that they need to be able to go through the study, or they may believe that they may not adhere to the study because they may be African American or Latino or Hispanic, these are all biases that most certainly plays out in terms of whether or not someone is asked to participate in a clinical research study in cancer.
Dr. Barrett, we are talking to the oncology community. What steps do you recommend programs take to build trust with patients in marginalized groups?
So trust is interesting, and I love the fact that you're asking this question because I love to really think about trust in multiple ways, as again, many of us have been. Certainly wanting to build trust, but part of building trust is to your question, how do we become trustworthy cancer centers providing care for a diverse patient population? And in that process, implicit bias most certainly is one of those factors, ensuring that our organizations have in place the appropriate tools and resources, such as, for example, if we have patients that are Spanish-speaking, making sure that there's an ease of being able to participate fully as a patient in their care by removing the barrier of language. Also, that means in our materials, in our brochures, and also in our interpretation services. How do we ensure that we are, as a cancer center, being able to respond to that? The same thing is true for other languages as well, whether it be Mandarin, French, et cetera. How do we make sure that the patient population that we're serving in our communities are the key part of how we provide culturally appropriate, culturally sensitive, and culturally responsive resources, tools, and also the interaction, the patient-provider interaction?
Where can cancer professionals go to find resources or help when they want to address these issues in their programs?
So the AAMC, which is the American Association of Medical Colleges, which really has a wealth of resources that really highlight both individual activities that one can really focus in on to address their own biases at the individual level. It also provides some really good direction around how do organizations, how do our cancer centers ensure that our staff, our faculty, our clinicians are also diverse, so that way the populations that are being served are also reflected in the people who are providing their care. There's also resources such as the IAT, the Implicit Association Test, that is actually out of Harvard, and so one can simply Google IAT, Harvard. They'll find that test, and it will also allow you to do your own individual test for you, your colleagues, your peers, and even your own family members to be able to look at and see where we actually fall within our own implicit biases. I have taken the test several times and found that there are some key areas that I, who have been dedicated my entire career to this area, has also my own implicit biases based on the fact that our biases are based on our social, cultural experiences. We all live in this world. We're socialized in this world from the moment we're born. So all of us kind of drink that water. And through drinking that water, we also then exhibit this, whether we realize it or not. And so through this test, it allows you to kind of become more aware of some of your own gap areas and then the types of resources that one can utilize. There's also at Duke, the Duke Office of Diversity and Inclusion, ODI, you can actually go on that website, and there they have a phenomenal clearinghouse of resources as well. And it allows you to utilize resources that are individual, that are group, that you can actually help to start charging and training our minds on a day-to-day basis through a calendar process, or even really thinking about more structural change within our system.
Are there any other areas that we should be looking to employ these diversity and inclusion practices?
The other piece I would add is engaging our community more in the work that we do. And sometimes as cancer centers, we can most certainly be more siloed from our community, but we actually can have the greatest impact by building trust, by engaging with our community members, so that when people hear the words, "you have cancer," and they have to come to your cancer center, you're not a foreign place to them. They actually know more about cancer because we, as members of the Cancer Community Professional Network, are actually engaging with our community as partners toward understanding the importance of screening, the importance of care, the importance of survivorship and follow-up care for those who are diagnosed. Our community can be key partners in that. That's a key way to both build trust with our partners and with our community, and it's also a great way to ensure that when our community members, our family who will be impacted one way or another with cancer, whether directly or through someone that they love, when they come to our cancer centers, they know that it's a safe and trustworthy place because we've been engaging with the community in advance.
You can head to the show notes for links to the resources Dr. Barrett talked about today. On our next episode, improving adherence to oral anti-cancer medication regimens. That's next week. For the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.